Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Thursday, September 24th, and it is 5 p.m. So, the vast majority of hospitalized COVID-19 patients show lung damage 6 weeks after discharge. But this proportion drops significantly after 12 weeks, suggesting that the repair mechanism is there, but takes some time. So again, this is something that we've known people are seeing long-term, or I should say more long-term effects after this respiratory illness than may be seen with other respiratory viruses. Now, a study of 86 patients tracked lung and heart outcomes in COVID-19 patients, and it showed that shortness of breath is the most common symptom or complaint 6 weeks after discharge, affecting about 47% of patients. Okay, which is almost half of them are still complaining of shortness of breath a month and a half after discharge, followed by cough, still persistent in about 15%. Now, at 12 weeks, the number of people experiencing shortness of breath dropped to below 40%. Again, not a rapid decline, but still numbers are coming down. But the same 15% were still coughing, which is interesting because that didn't change, again, in double the amount of time, so in 3 months. Now, the 12-week timeline is important because in many other lung diseases at this time point, at 12 weeks, they can estimate resolution or recovery from an illness. Now, 30% of survivors of the SARS virus in 2002-2003, that outbreak, experienced persistent pulmonary impairment at 12 weeks. So again, this is not uncommon for coronavirus. The study is ongoing, and they have hopes of gathering post-discharge results for more than 150 patients at the 24-week time frame. So again, they looked at 3 months, and now they're going to look again at 6 months. Now, the study participants' average age is about 61. 65% of them were men that were hospitalized an average of 13 days. So we're talking about a significant infection. About 50% were smokers, 65% were overweight or obese, and 20% required ICU and mechanical ventilation. Okay, so they're looking at a pretty significant population of people that were severely affected. So we're not talking about the casual person who gets coronavirus, stays at home, and does fairly well, loses their sense of smell, fatigue, cough, whatever it may be. We're talking about a good percentage of people that were in the hospital, including ICU and on a ventilator. Now, at 6 and 12 weeks, participants had lung function tests, CAT scans, echocardiograms, and all kinds of special blood testing. At 6 weeks, 88% showed lung damage from inflammation on their CAT scans, but dropped to only 56% by the 12-week mark. So as we tend to see, clinically, people tend to improve faster than their radiologic studies. Oftentimes the radiologic studies lag behind, so that if 56% are still showing inflammation at the 12-week mark, remember only under 40% were complaining of symptoms in terms of shortness of breath. So as that number on CT decreases, clearly it's going to correlate in the clinical picture, but people tend, like I said, to improve clinically faster than they do radiologically. Now, follow-up echocardiograms showed diastolic dysfunction in nearly 60% of patients, and that's where the heart at certain times of the cardiac cycle is not doing well. But they said they could not be linked directly to the virus. Many ICU patients in general will experience this type of problem on echocardiogram, so it's not specific to coronavirus, but it's just interesting to compare. Now, although, again, a small number, it may be a good sign to show that virus-related heart problems may not be as severe. Again, this is not a big enough study to declare you're all safe, nothing's going to happen to your heart. But again, with the severity of illness that these people experienced, the numbers were small having heart problems. Now, this does drive home the need to implement structured follow-up care for COVID-19 patients. Understanding the long-term lung effects might get clinicians to treat symptoms and lung damage earlier in the disease course and potentially decrease that inflammatory response early enough. I know somebody had asked me a question the other day about implementing steroids, and that is one thing that they're looking at. Steroids do block the inflammatory response. Clearly, too early in the course of the infection, you can impair the body's ability to have a proper immune response, and you can't do that because you don't want to allow the virus to go unchecked. But once the virus is sort of, I don't want to say run its course, but sort of run its infectious course, then you're dealing with all the immune response, the inflammatory response afterwards. And if you can minimize that, if doctors can minimize that, maybe these long-term effects will be made shorter. Now, are there potentially many other long-term effects of this virus, including issues with the brain, blood clots, blood vessel problems, mood and fatigue-related concerns, and more? So this is just one study that I was looking at based on pulmonary problems because it is a respiratory virus. So we do look at that as a main symptom. But there are people experiencing all kinds of other symptoms. So more science, more studies are going to need to be looked at to determine the best way to deal with those type of issues. Now, as time goes by, all of these long-term issues will either be linked to COVID-19 directly or not. But only time will tell. So whether it's linked directly to the virus or, as I said, the inflammatory response that the body mounts in response to the virus will be they'll need to know the difference in order to treat them appropriately. So lots of science today. Sorry about that. It just was something that interested me. Hopefully you got something out of it as well. On that note, again, it's rainy here again in South Florida. We had a couple of days without rain. Who knows what's happening? It's coming back again. Hopefully you guys will have a nice weekend. Hopefully we'll have a nice weekend. But in the meantime, I will see you again tomorrow for another Live in 5.